What about patent foramen ovale, otherwise commonly known as hole in the heart? Well, this is a very common condition. When we're babies inside our mother's fetuses, it's actually normal to have a hole in our heart because our lungs aren't mature. And so we rely on our mother's circulation to provide oxygen to a baby. And so that hole in the heart is actually a protective, appropriate mechanism. Once we're born and our lungs start to mature, that hole should close off. However, in 20% of patients, that doesn't occur. And so you have what is called a patent foramen ovale, or a hole in the heart that remains. Now, it's very common. So 20%, so 1 in 5 people walking around actually have this. In the vast majority of patients, this won't cause any issues at all. And a lot of people don't even know about this. It's an incidental finding. However, under certain conditions, the flow of blood can change such that blood flows through this hole from the right side of the heart into the left side of the heart. Now, why is this a problem? Well, if we develop any sort of clot or foreign material, air, fat, or blood clot on the right side, and it passes through that hole to the left side, remember that left side, when it squeezes, pumps blood to the brain and to all the other tissues. So what can catastrophically happen is some of that foreign material can go to the brain and cause a stroke. Now, previously, if a patient had a stroke with no other cause identified, and in the part of the workup by the doctor, they were found to have a PFO, they were placed on blood thinners in the hope that they wouldn't have a stroke again. If, despite being on blood thinners, they had a recurrent stroke, then the suggestion was to go ahead and close that hole. Well, fortunately, the guidelines have now changed to say that if you have a stroke and there's no other clear cause identified, and the only thing your doctors can find is this hole in the heart, then it is recommended to close that hole. Now, the good news is, again, in experienced hands, this procedure can be done very simply and very effectively in a matter of under 15 minutes. So this particular device is the device that I use in 90% of patients. It's actually done consciously under sedation with just local anesthesia. A wire is placed crossing from the right side through that hole to the left side of the heart. And then a device which consists of 2 discs is placed, one disc on the left side of the hole, pulling back to seal that hole, and then another disc on the right side. This procedure literally takes me between 10 and 15 minutes. As I said, is done under just local anesthetic with mild sedation, and is a day procedure, meaning after resting for a few hours after the procedure, the patient can return home. You remain on 2 blood thinners for a month, and then thereafter, as the device grows in and becomes part of the heart, just a baby aspirin for the rest of your life. And you can see there with that device closing that hole in the heart, no longer can any clots get through that hole, therefore preventing the risk of a recurrent stroke.